Hello everyone. Obesity is no longer just a cosmetic issue. It is a chronic relapsing metabolic disease. Globally, its prevalence is increasing rapidly and it is strongly associated with conditions like type 2 diabetes mellitus, cardiovascular diseases, non-alcoholic fatty liver disease, and certain cancers. Traditional approaches like diet and exercise remain fundamental, but for many patients, they are not just sufficient. This is why newer pharmacological agents like Ozempic and Mounjaro are changing the landscape of obesity management. What is Ozempic? Ozempic contains semaglutide, a GLP-1 receptor agonist. GLP means glucagon-like peptide 1 is an incretin hormone secreted from intestinal L cells in response to food intake. Semaglutide works through multiple mechanisms. So let's look into the mechanism of action. In pancreas, it enhances glucose-dependent insulin secretion. It suppresses glucagon release. In brain, it reduces appetite and food cravings. In gastrointestinal tract, it delays gastric emptying, leading to prolonged satiety. Clinical impacts of this drug: HbA1c reduction up to approximately 1 to 1.5%, significant weight loss approximately 10 to 15% in higher doses, cardiovascular benefits as shown in many outcome trials. It is administered once weekly via subcutaneous injections. Now, what is Mounjaro? Mounjaro contains tirzepatide, a novel dual incretin agonist. It targets GLP-1 receptors and GIP, that is glucose-dependent insulinotropic polypeptide. Why is this important? GIP has complex metabolic effects. It enhances insulin secretion. It may improve adipose tissue metabolism. In many cases, it amplifies GLP-1 effector when used together. Mechanism of action: it has strong insulinotropic effect. It has greater appetite suppression, and also it has got enhanced energy balance regulation. Clinical outcomes of Mounjaro: HbA1c reduction up to 2%, weight loss up to 20% or more in some trials. This makes tirzepatide one of the most potent anti-obesity pharmacological agents currently available. How do these drugs work? Both drugs act through the incretin system, which plays a key role in postprandial metabolism. Key physiological effects of these drugs: central appetite regulation leading to reduced hunger via hypothalamic pathway. Number second is the delayed gastric emptying leads to early satiety and reduced caloric intake. Number third is improved insulin glucagon balance, which calls for better glycemic control. Possible effects on both reward pathways, which promotes reduced preferences for higher caloric foods. These combined effects lead to sustained weight loss and metabolic improvements. Now, similarities between the two drugs, that is Ozempic and Mounjaro. Both medicines share several important characteristics. Both are weekly subcutaneous injections. Both act on incretin pathways. Both promote clinically meaningful weight loss. Both improve glycemic control in type 2 diabetes mellitus. Both provide cardiometabolic benefits. They are both part of a new era where obesity is treated as a biological disease, not just a lifestyle failure. Now, key differences in the two drugs. Which one is more effective? Despite similarities, there are some key distinctions. In mechanism, Ozempic is a GLP-1 receptor agonist. Mounjaro is a dual GLP-1 plus GIP agonist. In efficacy, tirzepatide shows greater weight reduction in head-to-head and indirect comparisons. In metabolic effects, tirzepatide may have additional effects on fat metabolism. Now, side effect profile. Both have GI side effects, but intensity may vary. Clinical use: choice depends on the patient profile. Cost: and availability and the physician's preferences and physician's experience with these drugs. So while Mounjaro may appear more potent, the best drug is always patient specific. Why are these drugs so popular nowadays? These There are multiple reasons behind their rapid rise. First is the clinical effectiveness. Patients are achieving weight loss previously seen only with bariatric surgeries. Number second is the simplicity. Once weekly injections improve compliance. Number third is the social media influence. Celebrities and influencers have amplified awareness about these two drugs. Shift in medical perspective is also one thing. Obesity is now recognized as a hormonal and metabolic disorder, not just a lack of willpower. However, this popularity has also led to misuse and unrealistic expectations. Now let's talk who can use these medications. These drugs are indicated in type 2 diabetes mellitus, as we already discussed, especially when weight loss is desired. Obesity management when BMI is greater than 30, or when BMI is greater than 30 with comorbidities like hypertension, like dyslipidemia, like obstructive sleep apnea, in some high cardiovascular risk patients, particularly for GLP-1 analogs with prone CV benefits. Prescription must always follow clinical evaluation and guideline based decision making. Now, who should not use these drugs? Contraindications and cautions include absolute or strong contraindications, that's personal or familial history of medullary thyroid carcinoma. Number second is the Mantoux syndrome. Number and we have related contraindications also with the history of pancreatitis in some patients, severe gastroparesis, advanced GI diseases. We have special population. In pregnancy, these are not recommended. And during lactation, one should avoid these drugs because risk benefit assessment is essential before prescribing these drugs. Now let's look into the side effects and safety concerns. Common side effects include nausea, vomiting, diarrhea, constipation in some patients. These are usually dose dependent and transient. Serious but rare side effects. These are pancreatitis, gallstones in some patients due to a rapid weight loss, possible thyroid C cell concerns in animal studies. A practical tip for you is that slow dose titration significantly improves tolerability. Important advice before using these drugs. See, these medications should be viewed as adjuncts, not replacements. Key points to remember are that these must be combined with calorie restrictions and physical activity. Long term therapy may be required in these drugs. Stopping treatment often leads to weight regain. Patient education is critical to avoid unrealistic expectations from these drugs. In conclusion, Ozempic and Mounjaro represent a major advancement in metabolic medicine. They offer you effective weight loss, better glycemic control, cardiometabolic benefits. However, they are not magic drugs. The success of treatment depends on proper patient selection, medical supervision, sustainable lifestyle change. And in the end, the goal is not just weight loss, but long term metabolic health. Hope you enjoy this video. See you in the next one. Peace.